Thanks for joining me today. My name is Sean Egglestone and I'm a registered dietitian. Today, I'm going to make a video on how you can reduce your risk of having a heart attack. Now, I've worked with thousands of people that have come to the hospital with heart disease who have suffered a heart attack, and I'm going to share with you what I've learned about these individuals so that I can help you reduce your risk for having a heart attack. Now, I've identified three major risk factors for heart disease, and these are what I consider the prerequisites. Nobody just comes to the hospital, has a heart attack out of the blue. And we're talking very, very, very few people, the vast majority of the people that I've seen that had a heart attack, they had three risk factors. They had an elevated blood pressure or hypertension, they had an elevated lipid panel, and they were obese. These three factors are found nearly across the board in individuals that have heart disease. So if we can prevent or treat these conditions, we can significantly reduce our risk of having a heart attack. Now, if we have diabetes on top of that, our risk for a heart attack goes up tremendously. So the first that we're going to talk about today is an elevated blood pressure. The current recommendations as of 2017 is hypertension is diagnosed as a blood pressure of over 130/80. So you want your blood pressure to be 120/80 or less. If you have blood pressure above 130/80, you have high blood pressure. Now, about 47 to 48% of Americans have high blood pressure, and unfortunately, many of them don't even know they have high blood pressure. And that's why it's so important to follow up with your physician or your healthcare provider and get your blood pressure checked and make sure you're on top of that. And that's because when we have an elevated blood pressure, it puts pressure or strain on our arteries and can damage the very small vessels. They're called capillaries. They can damage them, specifically in our kidneys. They can cause kidney disease. So high blood pressure is a primary risk factor for heart disease, stroke, or lack of blood flow to the brain, as well as kidney failure. So that's why it's so important that we keep our blood pressure under control. High blood pressure amounts to around 475,000 deaths annually in the US, which is a huge, huge number. We're worried about COVID right now in the middle of 2020, and I'm telling you, you are much more likely to die from diseases caused by high blood pressure than you are from COVID. So what can we eat to lower our risk for high blood pressure? Well, what's more important is actually what we don't eat. You don't want to have too much salt. And one of the things that I hear more frequently than anything when working with patients is they say, I don't salt my food. Now, 60 to 70% of the sodium in your diet comes from foods that already has salt added to it, whether it's condiments, hot sauces, flavorings, frozen foods like pizzas and burritos, as well as canned goods. So what I look for when I'm shopping is under 300 milligrams per serving. Now, on the front of labels, you might see no added sodium or no added salt. You might see low sodium, less sodium, reduced sodium. I ignore those because some of the lowest sodium products in the grocery store actually don't have anything related to salt on the label itself on the front. So I always turn it around and I look for under 300 milligrams. Now, if you have two products that you're comparing, I always pick the one that's lower in sodium. Obviously, the lower the better. Now, foods that are great at reducing your risk for high blood pressure is anything with a dark purple color. Things like cabbages and beets, they help release nitrous oxide and it helps open up your arteries, causes vasodilation, which is great for your blood pressure. All of your fruits and vegetables are going to be low in sodium. Your whole grains in the bulk bin section, whether it's oatmeal, brown rice, quinoa, those are all very low in sodium. I get dried beans, or of course, if you get canned beans, I pick the ones with no added salt or the lowest sodium possible. And of course, your bags of pasta, just plain noodles, there's no salt in that. So I always look at the back label and get the lowest sodium. And again, most people don't get their salt from the table salt shaker. They get it from foods already in it. So it's very, very important that you go through your pantry, go through your fridge and your cupboards, and throw out anything that's 300 or higher per serving. On my website, SeanTheRD.com, under recommended resources, there is a page full of meal planning, recipes, recommended resources that will have a ton of information on how you can design a diet that's low in sodium. So check out those resources if you're interested. Now, the second part of the trifecta that we're going to be talking about today is an elevated lipid panel. Now, the American Heart Association recommends that for individuals 20 and older, you get your lipid panel checked every 4 to 6 years. Now, your lipid panel consists of 4 things: your total cholesterol, your triglycerides, your HDL, and your LDL. Let's talk about what those mean. So your total cholesterol, you want that number to be under 200, but the lower the better. Under 150 is ideal, okay? No autopsy proven reports have shown anyone to have died from a heart attack with a cholesterol under 150. So that's why I recommend under 150 is best, but certainly under 200. You want your triglycerides. That's the circulating fat in our blood. It's naturally occurring, but you want that to be under 150. Diets high in refined carbohydrates, white sugars, and excess calories can cause those triglycerides to go up. Your HDL and your LDL, those actually aren't cholesterol at all. Those are cholesterol transporters. So HDL takes cholesterol away from the peripheral tissues, whereas LDL, your bad cholesterol, that deposits cholesterol in your tissues, in your arteries, causes atherosclerosis, plaque, or hardening of the arteries. That's why it's bad. Lousy. So you want your HDL to be between 40 and 80, and you want your LDL to be under 100. Now, if you have a risk factor for heart disease, you want it to be under 70. But seeing as many Americans will die from heart disease, I would say that it's a good recommendation to have your LDL under 70 just in case. Now, of these, the 2 numbers that I care most about are your total cholesterol and your LDL. Your HDL, from what I've seen, isn't as big of a factor, but your LDL and your total cholesterol are much, much more important. With that being said, the vast majority of the people that I've seen that have come to the hospital with a heart attack actually have a normal lipid panel. And that's because by the time they have a heart attack, they're on a statin that's lowered it. So while statins do help lower those numbers, having a good lipid panel on drugs is not the same protection as having a good lipid panel not on drugs, not on statins. So just because your numbers are good, but you're taking a medication, does not mean you're in the clear. You still need to eat healthy. So what can we eat? Well, the number one reason why people have an elevated cholesterol is not from dietary cholesterol, it's actually from dietary saturated fat. Now, for Americans, the number one source of saturated fat is dairy products, cheese, milk. So you could choose 1% or non-fat milk or low-fat cheese. Those are all fair recommendations. But if you've watched any of my other videos or have heard me, any of my lectures, my public speaking, you'll know that I don't recommend dairy at all. I think it's for baby cows. It's growth hormone to allow them to put on 400 pounds in several months. It's not meant for adult humans. And it's actually a poor source of calcium. You actually pee out more calcium than you take in for every glass of milk. And we know from the nurses' study that the more milk people consumed, the higher their risk was for hip fractures. So it's not really shown to be particularly effective against osteoporosis either. So I recommend cutting out milk and cheese as much as possible. If you want to sprinkle a little cheese, a little Parmesan or something for flavoring, that's fine, but no cheesy dishes like pizzas and lasagnas, and cut out milk altogether. There's plenty of great plant milk alternatives like almond milk, hemp milk, oat milk, soy milk. So go ahead and enjoy those. There are recommendations online for consuming fish twice a week to help lower your lipid panel or improve your risk for having a heart attack. However, the Harvard School of Public Health actually mentions a good point, and that is that the protection effects, the heart protective effects of consuming fish, may at least be in part to the fact that people aren't consuming red meat and processed meat. So it might not be because of fish exactly, but because people aren't eating worse things. And we do know that fish is the number one source of environmental pollutants in our diet. There's approximately 12 pieces of microplastics for every 3-ounce portion of fish. So these plastics all around us are degrading to about the size of a grain of sand, and they're getting in our seafood as well as radiation, poisoning, DDTs, flame retardants, dioxins, PCBs. Fish is the most polluted food in our diet by far. It's also will increase your risk for things like kidney stones. It's very acidic on the body. And while fish does have omega-3 fatty acids, which are good for our health, the majority of the fat that comes from fish is actually bad for us, as well as all of those other points that I mentioned. So I actually don't recommend fish at all. I think that beans would be a much better uh, food replacement for fish, because anything that's high in fiber will also help lower your cholesterol. So our body recycles cholesterol. So when we have a diet that's high in fiber, that fiber binds to cholesterol, we poop it out. So oatmeal, brown rice, whole grains, beans, lentils, chickpeas, these foods will help lower your cholesterol. The last factor that we're going to talk about today is obesity. Obesity is the third part of the trifecta. So we've talked about blood pressure. We've talked about lipid panel. The last one is obesity. The vast majority of the heart disease patients that I see are obese, as well as 2/3 of Americans are obese. And we know that obesity increases our risk for all-cause mortality. Every aspect of the reason why people might die, if you are obese, it puts you at a higher risk for those things. And we know from studies that as people lose weight, their blood pressure improves, their lipid panel improves, as well as things like their insulin sensitivity and their diabetes and their glucose control. All of these things, these factors for disease, all improve as people lose weight. So, without spending an hour talking about what the best way is to lose weight, on my website, SeanTheRD.com, under Learn, there's a whole bunch of presentations on heart healthy eating, shopping, cooking, diabetes, as well as the best sources of carbs, fats, and proteins. But generally speaking, a diet that's centered around whole plant foods, such as fruits, vegetables, whole grains like brown rice, brown pasta, whole wheat bread, oatmeal, millet, quinoa. There's barley. There's tons and tons of whole grains, beans and lentils that I mentioned earlier. All of these foods are very, very low in calories. And that's really what this is about. It's not about calorie counting, it's not about portion control. You can eat as much as you want of the fruits, the vegetables, beans. I'm not talking pork and beans. I'm not talking beans with cut up hot dogs. I'm just talking cook up some dried beans. So these foods are actually very healthy for our heart. They help lower our lipid panel, they help lower our blood pressure, and they help us lose weight all at the same time. They are magical, magical foods. And they're all low in calories, 100 calories per pound of most vegetables, 300 calories a pound of most fruits, and 500 to 600 calories per pound of most whole grains and beans. Whereas chicken is 1,000 calories a pound, or I should say meat in general averages out to about 1,000 calories a pound. Junk food is anywhere from 1,500 to 2,500 calories per pound. That's why those 100-calorie snack packs are so small, but a banana, 100 calories, much bigger. So having a diet centered around whole plant foods is the best for weight loss as well as improvement in the other risk factors that we talked about today. And of course, if you want to dive into these topics more, check out my videos. There's a few hours of content and I'll go into them in much, much greater detail. So I hope you found this information helpful. Again, the reason why people are getting heart disease, why they're having a heart attack, it's not, for most of them, it's not just a surprise. They have to have three things. They have to have them: high blood pressure, elevated lipid panel, and obesity. You have to have those things in order to have a heart attack. Of course, there's some exceptions, but that's what I have learned working with thousands of open heart patients. Thanks for watching. If you have any questions, you can post and leave comments down below. If you're watching this on YouTube, don't forget to smash the subscribe button. And if you have other questions, you can go over to SeanTheRD.com and contact me and send me some questions, and I'll be happy to get back to you. Thanks for watching. Cheers.